Hi, good morning. I am Maria-Paula and today I will be performing the vital signs. The traditional vital signs are body temperature, pulse, and respiration and blood pressure. The vital signs we should be looked at in total are checked to monitor the function of the body and also should be evaluated with reference to clients' presence and prior health status. Their usual vital sign results, if known and accepted, the normal standards. The equipment or the materials needed is um, digital pulse if we have, and we have um, digital thermometer, and we have also stethoscope, and we have also we call this speed manometer, or we call the BP or AP. Um, and then now let's proceed to check the body temperature of our clients. First, we will perform the hand hygiene. After we perform the hand hygiene, first gather equipment or assemble materials needed. You need to explain the procedure to patients. Then take the thermometer from each pack and wipe wipe with clean ball bulb from the bulb to the end. And then after we wipe the bulb, we can now turn it on and place the thermometer well into the axilla of our patient. Pat the axilla dry if very moist. And then place the patient's arm over his chest. And then leave the thermometer in place until a signal is heard. So she got a 38.0 degree Celsius. And then take the thermometer and read the result. Disinfect the thermometer from the stem to the bulb. Then after that, and put it back into the receptacle. And then note and record the results, including the abnormalities. Then we will now proceed to check the pulse rate of our clients. Position arm, position arm next to the body, supine or sitting with the palm facing downward. Place the first, second, and third fingers over the radial artery, applying just enough pressure with the fingertips. And then rest the thumb on the back of the wrist. The rationale is using the thumb is contraindicated because the nurse thumb has a pulse that could be mistaken for the client pulse. And then after we locate the pulse, count the beat in one full minute using a watch with a second hand. So we got 60 beat. If there are irregularities, repeat and count the for another one full in a minute. Then note and record the results, including the abnormalities. And then we will now proceed to the to check the respiratory rate of our clients. With the fingertips are still in the place after taking the pulse rate. Observe the patient's respiration, then count the number of the breaths in one full minute. So we got 17 breaths in one full minute. Note and record the unusual characteristic of breathing. Then we will now proceed to check the blood pressure of our clients. Um, Position the patients comfortably, supine or sitting with the palm upward with an arm supported at the level of the heart. The rationale is the blood pressure increases when the arm is below heart level and decreases when the arm is above heart level. And then wrap the deflated cuff gently around the patient's arm about 2 centimeter 2 centimeter above the antecubital fossa. The rationale is the bladder inside the cup um, must must be directly over the artery to be compressed. The reading is accurate. And then locate the locate the I locate and feel the brachial artery. After we locate the brachial artery, place the attachments of the stethoscope appropriately with an angle slightly tilting uh, forward. The rationale is the sounds are heard more clearly when the ear attachments follow the direction of the ear canal. The bell side of the amplifier of the stethoscope over the brachial pulse. The rationale is because the uh, blood pressure is low, frequency sound is the best heard with the bell-shaped diaphragm. Hold the diaphragm with the thumb and the index finger, and then pump up the cuff until the sphygmomanometer reaches 30 millimeter of mercury above point where the brachial pulse disappeared. And then after we pump the cuff, we will now release the bulb of the cuff carefully so that the pressure decrease at a rate of 2 to 3 millimeter of mercury per second. The rationale is if the rate is faster or slower, an error in measurement may occur. So we will now release. So we got 100 over 70 of her blood pressure. And then deflate the cuff rapidly and completely. And then remove the cuff. And then after remove the cuff, wipe the cuff with an approved disinfectant. Then after that, we will now document and report the pertinent assessment data.